Hi students, today's topic is about X-ray, skull and spine. My name is Dr.Prince Hiliston Thomas. I am first year PG resident at Pushpagiri Medical College, Tiruvalla. Now, what are the major indications of skull radiographs? Firstly, dysplasias. What are the other conditions where you do an X-ray of the skull? For diagnostic survey in abuse, where you look if there's any fractures or any trauma or any injury. In patients with abnormal head shapes. In infections and tumors affecting the skull bones. In case of leukemia, multiple myeloma. In trauma, to document medico-legal case. Here you can detect fractures or other indentations in the bone. Detections of calcification, hyperostosis, lyticosclerotic metastasis. Now, what are the views in which you take a skull radiograph? The basic views are an anteroposterior axial view. It's also known as the Townes method. Then you have the lateral view, the posterior and anterior view. It's also known as the Caldwell method or the PA axial view. Then you have special methods known as submentor vertex view and PA axial views. Now, what are the landmarks in skull X-ray? This point is the glabella. This is the nasion. Now, you have the external auditory meatus and the external occipital protuberance. These are the landmarks in the skull X-ray. Glabella is situated in the midline of the forehead, just above the level of the superior orbital margins. What is nasion? Nasion is the depression between the glabella and the nasal bone. External auditory meatus is the hole surrounded by the pinna of the ear. The external occipital protuberance in the midline inferiorly over the occiput. Now, what are we actually going to see in these skull radiographs? We actually take them to look if there's any defects in the bone or the sinuses. So, first we have to know what are the structures we can see in the radiograph. Firstly, you have the nasal septum. This is the nasal septum. Then, you have the frontal sinuses. Look, these are the frontal sinuses. See, here when you look at this frontal sinus, you can see that the frontal sinus on the right and the frontal sinus on the left is asymmetrical, which is a normal finding. See, they are not symmetrical. Here one looks bigger and the other looks small. This is a normal finding. So this is the frontal sinus. And then you have the maxillary sinus. This is the area of the maxillary sinus. This is the maxillary sinus. And later, now we are going to the ethmoid sinus. See, this is the area of the ethmoid sinus. Next step is you look at the inferior turbinates. This is the inferior turbinate on the left and the inferior turbinate on the right side. Then you have the odontoid process. What is the odontoid process? The odontoid process or dens of the vertebra. See, it will be like this. This is the odontoid process or dens of the vertebra. And then, next, what do you look for? Look at the sagittal suture. This is the sagittal suture. Then, the superior orbital fissure. This is the superior orbital fissure. This is the coronal suture. This is the petrous ridge. This is the sphenoidal ridge. Now, what is the significance of this sphenoidal ridge? In case of sphenoid dysplasia, you get a bare orbit sign where you won't see these two lines. Then, where do you, this is the mastoid process. Innominate line. This innominate line is blunted or obscured in case of sphenoidal dysplasia. This is the hard palate. Now we have discussed the basic anatomy of the structures that we see in skull radiograph. This is the parietal bone, the area of the lambdoid suture. This is the occipital bone, the occipital bony protuberance, the foramen magnum, the petrous ridge, the posterior clinoid process, the petrous ridge, the mastoids. Okay, now let's discuss more. You can see the parietal bone on either side. This is the lambdoid suture. This is the area of the foramen magnum. This is the petrous temporal bone. This is the area of the mastoid air cells. Next, this is the transverse sinus. This is how the transverse sinus traverses. This is the area of the sphenoid sinus. This is the greater wing of the sphenoid. And this is the superior sagittal sinus. Now, let's see the lateral view of skull. This is the vertex. Why do you take a lateral view of the skull? The lateral view of the skull is taken. Previously, it was taken to assess the pituitary gland. See, you can see the pituitary gland. The pituitary gland is housed where? It's housed in the sella turcica of the sphenoid bone. And under you have the sphenoid sinus. This is the sella turcica. This is the sphenoid bone. Anterior clinoid process, the posterior clinoid process. This is the frontal sinus. And then what do you have? This is the area of the maxillary sinus. This is the sphenoid sinus. This is the frontal bone. This is the vertex. This is the anterior clinoid process. This is the pituitary fossa in which the infundibulum rests. This is the parietal bone. This is the posterior clinoid process. This is the lambdoid suture. This is the external acoustic meatus. This is the occipital bone. Here you have the external occipital protuberance. These are the structures what we see in lateral view of the skull. Let's revise once again. This is the area of the maxillary sinus. This is the frontal sinus. The ethmoid sinus. This is the sphenoid sinus. This is the sella turcica, which houses the pituitary gland. The occipital bone, mastoid air cells, then the anterior arch of the C1 cervical vertebra, the mandible, and the coronal suture. This is how you take a skull X-ray. This is one of the view in which a skull X-ray is taken. What do you get? See, this is the foramen ovale, the foramen spinosum, the mastoid process in which you have the mastoid air cells. This is the ethmoid, you have the nasal septum. This is the area of the ethmoidal air cells. The ethmoidal air cells. Here you have the sphenoid sinuses, the mandibular condyle, the petrous pyramids, the foramen magnum. This is the occipital bone. This is another view in which the skull radiograph is taken. Here you see, this is the bony nasal septum. This is the frontal sinus. See, one is bigger and the other one is smaller. This is the inferior orbital rim. The zygomatic bone, the zygomatic arch, the odontoid or dens, the mandibular angle, the mastoid, the condyle, the maxilla, the coronoid process. This is the area of the maxillary sinus. The anterior nasal spine. This is another radiograph which helps you identify the part. This is the frontal sinus, the nasal bone, the hard palate. This is sphenoethmoidal plane, the hyoid bone, the mandible, the area of the maxillary sinus, the 6 areas of incomplete ossification in a newborn is next discussed. This is the fontanelle. This is the anterior fontanelle. This is the posterior fontanelle. This is the view from the top and the view from the side. This is the mastoid fontanelle. This is the sphenoidal fontanelle. This is the pterion, the bregma, the vertex, lambda. See, the posterior fontanelle fuses and forms the lambdoid suture. This is the mastoid fontanelle, also known as the asterion. At what age do these fontanelles close? The posterior and the sphenoidal fontanelles close during the first 1 to 3 months after birth. The anterior and mastoid fontanelles close during the 2nd year of life. Now we have completed discussion of the skull X-rays. So, what are the views of the skull X-rays and what are we looking in these skull X-rays? You should have a clear idea about these topics once we have covered this session. So, our next session